Puerperium is the period a woman goes through after the birth of the baby. According to the classic medical books, it lasts for about 60 days, or throughout the entirety of breastfeeding. This is established by the doctors, who focus on a biological basis, considering the transformations of a woman's body to return to the previous state before pregnancy. However, considering the emotional and psychological aspects of the woman, it could be said that puerperium extends to 1 or 2 years after the birth. There are no specific limits to puerperium with this belief. It's very subjective because it depends on each woman's perception. There's a hormonal revolution related to physical changes that heavily impact the emotions of the mother. Puerperium is a period of changes, adaptation, learning, and new expectations. To care for the baby, there are changes in the brain that involve the state of alert, senses, and cognitive functions. It's a joyful period because of the presence of the baby. Creativity flourishes, it's scientifically confirmed. But it's also a period of great vulnerability and emotional fragility. Fears, insecurities, and doubts about the care of the baby might appear. Changes in routine, roles, desires, and emotions represent big challenges for the woman and her partner. Coming back to the conception and focusing on physical changes, the puerperium can be divided into immediate, covers the first 24 hours, mediate, from the 2nd to 7th day, and tardy, that starts in the 7th day. I will mention some of the physical changes that happen during puerperium. In immediate puerperium, during the first 24 hours, the uterus retracts noticeably to go back to its position in the pelvis. Lochia, or postpartum bleeding, appears. These are usually red and more abundant than menstruation. If you put the baby in your chest, after birth, the secretion of colostrum begins. This is important for the baby in order to acquire the first defenses against diseases. During mediate puerperium between the 2nd and 7th day, the milk release begins along with the breast engorgement. Breasts get swelled. Sometimes, there can be pain and a rising body temperature. The uterus continues the involution, and there are changes at a genital level. This depends on the method of birth, and if there was an episiotomy or not. In tardy puerperium, the postpartum discharges get noticeably clearer, turning white or yellow. This usually lasts for 2 to 6 weeks after the birth. The uterus goes back to its place in the pelvis 12 days into puerperium. Red stretch marks get clearer. Zones of the body with higher pigmentation get clearer too, like the vulva and the anus area. However, this process can last for a few months. Abdominal muscles return to their tone, partially or completely. After a C-section, it's important to wear a girdle for 2 or 3 months, according to the doctor's orders. It's not recommended after a vaginal delivery because it interferes with the strengthening of the mentioned muscles. Menstruation can take several months to return, especially if breastfeeding is exclusive, on demand, and frequent. However, even if there's no menstruation, the woman could still ovulate. That's why a contraceptive method is recommended for sexual relations after the birth. You should consult your obstetrician when it's possible to return to sexual activity. Beyond the physical abilities, many women experience a lack of sexual desire for several months. This is normal. Most of the woman's energy, activities, and mental processes is directed towards the baby. I will share some tips to get through puerperium. You shouldn't overexert yourself. Taking care of a baby is time and energy consuming, especially if we choose to raise them with love and respect, attending to their needs in a fast manner. Another jobs, like house chores or answer the phone, can wait. Accept help from your peers, and if you have a partner, be fair in the distribution of work. Resting. When the baby rests, the temptation for the parents to finish other tasks is big. But it's important to your health, and the baby's, to take a moment or relax or sleep. Don't plan strict routines. It will be difficult to complete them, and that can be frustrating. Allow yourself to cry. Through crying, we release substances related to stress. That's why we usually feel better after crying. Allow yourself to experience all your emotions. You can go from tears to laughter in a second. Allowing your emotions to flow after the birth is positive, and it helps you deal with this better. Vulnerability is a way of being brave. Puerperium is a period full of changes and transformations. We must accept them and look for support around us to get through it.